Hello, my people. A lady has contacted me and asked me that I've talked about how to get belle. Say me never talk about how to avoid the belle. So you go, they important say make I talk how to avoid belle. Say you go help them, the women, to reduce the risk whether they take as they take some pills and other complications whether they face for life. And I don't look and say you go they important say I respond to some basic question of my students. But one thing I tell and say if you know one get belle, one thing where be say you go they do now be say not dey allow your man dey knack you without. Always dey make sure say the man wear something. Say provided the something wey the man wear no burst, say there are chances there say e no get belle. But me understand the question wey she dey ask me. She want to dey knack without protection. You understand? In that situation, I can still tell am say if you want to dey knack without protection, make you no get belle. The only thing wey be say you need to do now, you need to know your cycle. And based on say women they don't know your cycle now. So if you don't know your cycle, because it's recommended that if you know your cycle, your ovulation happens at the mid of your cycle. That is, your ovulation is if your cycle is 28 days, your ovulation happen at 14th day. But let's assume say most times women know they know. And because of this calculation, a lot of women don't get belle when they no want get belle, because they go just say at 16th day they say my ovulation don't pass, they go the knack, they can't still get belle. The reason we say there's what they call fertile window. In medicine, there's a period of time where we say if you knack within that time without protection, there are chances that you may get belle. You understand? And that fertile window is divided into two. People will get long cycle and people will in cycle they're short. And those people in cycle they're short. Even if you don't know your cycle, make sure you know that whether your cycle is below 25 days or is above that 25 days. And your cycle is the day where you see your period to the next time when you will see them. So if your cycle is below 25 days, what it means that your fertile window is between 7 to 19 days after you've seen your period. Do you understand? So if you have your cycle above 25 days, your fertile window it starts from 10th day to 22 days. What it means that if your fertile window is between 7 to 19 days, from 20th day, if they knack without protection, there are chances that you know get belle. If your fertile window between 10 to 22 days, from 23 days, if they knack, there are chances that you know get belle. A lot of people asking the question, why does a fertile window last up to 2 weeks? Why they say that ovulation happen between 12 to 24 hours? And why are we waiting for 2 weeks to avoid knacking, not to get belle, when it's only one day we are trying to avoid? Yes, because of a lot of things affect this ovulation. You see, stress, illnesses, and the hormone disruption can affect the time ovulation will happen. If ovulation is supposed to happen at 14th day, if you are stressed emotionally, mentally, psychologically, physically, it can make this ovulation to be earlier or later. That's why you need to avoid 10 to 22 days and the 7 to 19th day respectively, depending on if you are short cycle or your cycle is long. I know a lot of people will say there is contraceptives. Why are you worrying yourself of getting belle or not? Use any of them. But my advice on that is, if you never given birth to your children, you never born finish, my sister, no do all these contraceptives, especially all these implant pills, because it may affect your hormone to the point where we say when you want the belle, you feel no see am. So that's why I always recommend person, if you never born before, make you do normal one where they know, like CD, they use them. Even if you know like them, they try manage them. It's better than say it will affect you tomorrow. Do you understand? So that's my advice.